Okay, let's talk about 23, Standard 23, Substandard C. Explain Lyndon Johnson's Great Society. That's a program called the Great Society Program. Include the establishment of Medicare. Alright, so let's look. The Great Society Program was a domestic program by President Lyndon Johnson to try to deal with poverty in the United States, and also to try to deal with discrimination in the United States. We talked about discrimination, his passage of the Civil Rights Act of 1964 and the Voting Rights Act of 1964. And in the Great Society Program, he also concentrated on Medicare as hospital insurance for the elderly. And these are political and social interactions. The Great Society Program. The Great Society Program is equivalent to the New Deal of Franklin Delano Roosevelt. Government programs to help those in need. Alright, so those are our elements, and that's our theme. I want to show you here a list of Lyndon Baines Johnson's Great Society Program. Head Start was to help poor, disabled, or minority kids get an extra help or a good start on education. Job Corps to help the poor, and job training, inner city youth cultivate job skills and how to work, how to show up on time, how to do a resume, all those different types of things. And then Medicare is what we're supposed to talk about. In 1965 was created as an extension of Social Security benefits, and it provided for health insurance for the elderly to help the elderly pay for their hospital bills for extended health problems or repeated health problems. And Medicaid was to provide health insurance for poor people and the disabled. Okay, and VISTA was Volunteers in Service to America, kind of like the Peace Corps that was created. It was organized to help youth volunteers in the economically depressed United States, help them go out and help our country. But Medicare is what we're supposed to focus on here, this extension of Social Security. But let's first talk about what the Great Society Program was meant to do. And here is in the State of the Union in January 1964. We listened to some of this already, but I'm going to the primary source, the lips of President Lyndon Johnson. The Great Society Program was Johnson's attempt to declare unconditional war on poverty in America. And that's what he said. And this administration today, here and now, declares unconditional war on poverty. That means poor people, people without money, people without sufficient food or homes or whatever in America that were hurting. And so he declared war on poverty. And here he is. I'll let you listen to him in his State of the Union address.
And this administration today, here and now, declares unconditional war on poverty in America.
There he is. So in the Great Society Program, he declares war on poverty in America. That's very important to know. And he does that by instituting these things, along with Civil Rights Act, Voting Rights Act, these things here. And Medicare here is a very important part of the Great Society Program we need to study, and as an extension of the Social Security benefits. And here he is here in the same address. He says, we must provide hospital insurance for our elderly citizens under Social Security to protect him in his old age in a dignified manner against the devastating hardship of prolonged and repeated illnesses. So, you know, Social Security didn't really cover hospital stays, staying in the hospital for a long period of time. So here President Johnson gives a speech about we need to help the elderly in their hospital stays. Listen.
We must build more libraries in every area and more hospitals and nursing homes under the Hill-Burton Act, and train more nurses to staff them. We must provide hospital insurance for our older citizens, financed by every worker and his employer under Social Security. Contributing no more than $1 a month during the employee's working career to protect him in his old age in a dignified manner without cost to the Treasury against the devastating hardship of prolonged or repeated illness.
And so there he asked for help for Medicare, help for hospital insurance for the elderly. In other words, he wants Medicare to be passed, and it will be, and Medicare is going to give health insurance for elder people who stay in the hospital for long periods of time due to these illnesses, repeated illnesses or prolonged illnesses, to help them pay for their hospital bills and their stay there. And that's what Medicare does, and that's what we need to know. This is very much part of this Great Society program. Now, we've met our objective, but I'm going to go a little further here. I want to try to get you to understand something now. First of all, on a timeline here, we need to know the difference between the Great Society program and then the New Deal over here. The New Deal was FDR's attempt during the Great Depression to end suffering by people in the Great Depression. This is where he passes the Social Security Act. This is where we first get retirement insurance for people over 65 years old, right here in the Social Security Act. Very important to understand, this is in 1935. Okay, during the Great Depression, and this is FDR here. He's the one that was instrumental in passing the Social Security Act. Now, a lot of critics criticized FDR in making our government spend too much money. Very conservative people complained that FDR, here's the size of government before FDR, and here's the size of government today because of FDR, and this Social Security Act is a great portion of the size of our government. TVA and other activities he created during during the Great Depression, during his New Deal program, did as well. But here, 30 years later, comes President Lyndon Johnson and his Great Society program that is kind of equivalent to FDR's New Deal in that government's going to spend more money. And so a lot of critics say that Johnson went further than FDR, and he also increased the size of the government bigger. Now, the reason why the critics complain is because all this government agencies and all this money being spent by the government actually comes from the taxpayer. And more taxes are being spent because of FDR's New Deal, his Social Security Act, and then more taxes are being spent of the American people's money to support this Medicare program in the Great Society program. And a lot of people complain that 60% of our budget is mandated because of Social Security and Medicare, and they want to. There's currently reform to reform both of these so we won't spend so much money. Alright, but Medicare comes from Great Society and Johnson in 1965 as part of the Great Society program. You need to keep these separate in your mind now. Great Depression in 1935 was the Social Security Act. What is confusing is Medicare is a part of Social Security, but let's look at the years in which they were introduced, and that's going to be important for you to understand is this time spread. When were these created? Social Security Act 1935 during the Great Depression as part of FDR's New Deal. Here's FDR. We talked about that already. And now Medicare in 1965, 30 years later, under the Great Society program by Johnson. And it is Johnson that declared war on poverty in America, and Medicare was part of that. So this declaration of war on poverty is very much part of the Great Society program, as well as other programs. But I think with that we've met our objective. Explain Lyndon Johnson's Great Society program, include the establishment of Medicare. Ask questions in class, rewatch the video. Good luck on the quiz, test, EOCT.